Hello everyone, thank you for joining me today. My name is Tom Davia. I'm a financial consultant here at Alliant Retirement and Investment Services. Today we're going to be talking about Social Security, Medicare, and your retirement. We're going to be talking about how Social Security and Medicare programs work, discussing some important issues facing both programs, and a few effective strategies for supplementing these retirement benefits. If you've been concerned about Social Security and Medicare being reduced or eliminated, you're not alone. Both programs have been in the news quite a bit lately, and there's some talks of insolvency, tax hikes, increased eligibility ages. All that's created a lot of confusion around these programs, so we're here today to kind of walk you through that and answer some of your questions. Some educational resources for you. Our team here at Alliant Retirement and Investment Services is focused on helping you understand the ins and outs of investing and saving for retirement and much more. So take a look at our website if you get a chance. It is ARIS, ARIS.AlliantCreditUnion.com. There you can see the list of our weekly webinars, our podcast, which I'm the co-host of, and our financial blog and resources available to you as well. So how can we help you? We are a full services financial planning organization here at the credit union, a fiduciary firm. We can help you with retirement planning. We can help you with your investments, life events, and generational planning. So whether you have questions about today's topic, Social Security, your 401k plans, current investments, if you'd like to do an investment review, or if you had any major life events, it's a good time to check in on your financial plan and make sure it is structured correctly to meet your goals. All right, today's agenda. We're going to begin today's seminar with a quick look at the changing face of retirement. We'll review the structure of both Social Security benefits and Medicare. We'll talk a little bit about Medigap insurance and health savings account. And finally, we'll talk about some effective strategies for meeting your financial and medical needs during retirement as well, just so you don't have to solely rely on Social Security and Medicare. First of all, we start by talking about the changing face of retirement. Planning for retirement now is more important than ever. Things look different today than they did for previous generations planning for retirement. We have people living longer, longevity concerns. We have careers that are less linear than they were in the past. And really the responsibility of funding retirement has shifted towards the individual instead of the company offering the traditional pension plan. So it's more on the individual at this point. Retirement in the future can cost significantly more. We all hear about inflation in the news. We have inflation concerns as costs continue to rise, healthcare expenses, longer lifespans. Really what all that means is you need to plan for your money to last 20 or 30 or even more years. So help is available, right? That's why we're here. We're doing these meetings to let you know we have a financial planning services of the credit union available to you. So help is available. We have professional guidance to help you figure all this out. And really, when you have these conversations, timing matters. The earlier you start planning, the more options you typically have. And today's topic, understanding Social Security and Medicare benefits, is even more important now as you make your planning efforts. Social Security and Medicare are key pieces of the retirement puzzle, but they're often misunderstood. And knowing when to claim benefits, how those payments are calculated, and how the Medicare coverage works, this can all have a significant impact on your retirement and your income and your healthcare costs. Okay, let's first start and talk about Social Security. Social Security is really a general term that describes a number of related programs. So Social Security can cover retirement benefits, disability benefits, family and survivor benefit programs as well. It's really designed to supplement private savings and retirement plans. And in 2024, 68 million Americans received Social Security benefits. But when you look at the numbers, Social Security benefits typically represent about 30% of income of retirees, and that's according to the Social Security Administration. So, how does Social Security work? Well, it is mandatory funding. So, you probably see your contributions coming out of your pay stubs either as Social Security taxes or FICA taxes. So it's mandatory funding that comes out of our paychecks, and the tax proceeds, they go into a special trust fund that's established exclusively to pay Social Security and Medicare benefits and some administrative expenses. Now, to receive benefits, you depend on your full retirement age. So some people, full retirement age may be 66 in a few months. Most of us, it's turned into age 67. But you do have the ability to take what they call reduced benefits as early as age 62. So your benefit amount depends on your earnings work history. So it's based on the highest 35 years of earnings, and you can see that calculation in your Social Security statement. If you haven't looked that up before, it's available within your online account at ssa.gov. Now, if you wait past your full retirement age, you could receive up to an 8% increase per year in benefits if you postponed your benefits. Now, here are some of the issues that you might be hearing in the news about Social Security and the payments of the benefits. So we have the retiring baby boomer generation right now, which is causing a lot more payments out of the system than money is being received. People are living longer than was originally calculated in life expectancies, so more money again is coming out of the system than being paid in. We have fewer workers paying into the system. It's a pay-as-you-go system, so all the taxes collected in a specific month would be paid out the next month. So fewer workers have less money coming into the system. And you put that all together, and it's estimated by the year 2035, Social Security would exhaust the trust fund and may not be able to meet all of its obligations as promised to all retirees. It's currently estimated that if nothing changes, that there would be a 20% reduction in Social Security benefits across the board by the year 2035. Now there are some proposals on the table for improving the situation and not running out of money in 2035. So a few options here on the table, right? Raising the retirement age. As I mentioned, some of us, it's 66 in a few months. It's been raised to 67. There's some discussion about raising the retirement age to age 70 or starting incrementally to bring it up to age 70. There's also talk of means testing. What that means is cutting benefits for wealthier seniors. There's also the cost of living increase every year. So Social Security each year will give you a cost of living adjustment based on inflation. There's some talks of reducing that a bit, not to make it as much of an increase each year. There's also talk about investing trust fund dollars in the stock market and possibly diverting some of the payroll taxes to private accounts, which would then have some stock market exposure to it. Withstanding the market crisis of 2008, 2009, stocks historically have performed better than any other type of investment, although past performance can be no guarantee of future results. Next, we're going to talk about Medicare. All right, Medicare is a federal government program that helps older and some disabled Americans obtain and pay for medical care. It's administered by the U.S. Department of Health and Human Services, and it's the nation's largest health insurance program, which covered more than 66 million Americans in 2024. Now, Medicare is really broken down into two parts. Part A, hospital insurance. Part B, medical insurance. Part A, hospital insurance, covers most of the costs of a stay in the hospital, as well as some follow-up costs after time in the hospital. Part A pays some other outpatient medical services, including some home health care, but it does not cover the cost of prescription drugs. And under most circumstances, you do not have to pay a premium for Part A. Part B, a little different. Part B is medical insurance. This optional coverage is intended to help pay doctors' bills for treatments in or out of the hospital. It also covers many other medical expenses you incur when you are not in the hospital, such as the costs of medical equipment and tests. If you elect Part B, a monthly premium is automatically deducted from your Social Security check. You have two options for Medicare coverage: the original Medicare plan and Medicare Advantage, a managed care plan. Each of these programs have their pros and cons. The original Medicare plan, you pay your Part B monthly premium, and then you pay additional services as you use them. In 2025, the standard monthly premium was $185. Additionally, Medicare Part B deductible was $257 in 2025. If your modified adjusted gross income from 2 years ago is above a certain amount, you may pay more for Part B. Now, Medicare Advantage plans, it's an optional program through private insurance companies. They provide HMO type coverage. To determine which program is right for you or for your needs, you can call Medicare 1-800-MEDICARE, which is 633-4227, or you can also log on to www.medicare.gov. There are also some other options to consider: Medigap insurance and health savings accounts. We'll take a look at each one of these. Health savings accounts. So we have the creation of tax-free health savings accounts for anyone under age 65 who is enrolled in a high deductible medical plan. That's defined as one with a deductible of at least $1,650 for an individual or $3,300 for families. And these amounts are adjusted for inflation. The contributions are tax deductible. The maximum contribution to an HSA plan in 2025 was $4,300 for an individual and $8,550 for a family. There's also a $1,000 catch-up contribution for individuals between the ages of 55 and 64. So much like a retirement account or an IRA, health savings accounts allow for account holders to select a variety of investments that can suit their time horizon or risk tolerance. Also, the account balance can be maintained from 1 year to the next. Now, distributions for qualified medical costs are tax-free, but non-qualified, right, if they don't qualify for medical costs, non-qualified withdrawals are taxed as income and may be subject to a 10% penalty. Medigap insurance. If you choose the original Medicare plan, you might also be interested in receiving Medicare supplemental insurance or Medigap insurance. The term Medigap comes from the notion that these insurance policies will cover the gaps in Medicare payments. Medigap doesn't fill in all the gaps, but it may help. So before you buy a Medigap insurance policy, consider not only the services that are covered, but also the amount of benefits and the monthly costs of the policy. Also pay attention to how much premiums may rise in years to come. You may want to also compare Medigap with Medicare Advantage. For more information on Medigap insurance, you can again call 1-800-MEDICARE. That is 1-800-633-4227. Okay, now we're going to shift gears a little bit. We are going to be talking about planning for retirement and preparing for your financial well-being. Now, up to this point, we spent most of our time learning why you shouldn't count on Social Security and Medicare to cover all of your needs during retirement. Now let's talk a little bit about what you can do to ensure a comfortable retirement for yourself. Now, fortunately, today we have more choices than ever, which we'll discuss in a moment. But with these choices, however, more responsibility. It's up to you to determine whether you should contribute to a retirement plan, how much to save, and what investment choices to choose. So regardless of your age, investing for retirement should be among your top financial priorities. However, one of the greatest challenges for most people is realizing the need for a retirement investing program. According to financial experts, you'll need 70% or more of your final working year's salary each year during retirement. Okay, now here's some retirement savings vehicles you might be familiar with, right? Traditional 401ks, 403bs, IRAs. So we've established, right, since Social Security was never meant to be the sole means of support in retirement, you have other options for retirement savings. There's several tax advantage investment options for retirement savings, like I mentioned here, 401ks, 403bs. 403bs generally cover nonprofit and healthcare organizations, and IRAs are your individual retirement accounts. Now, when you look at these, there's two types of 401ks and 403bs. You have the traditional and you have the Roth plans. Traditional plans offer tax benefits. Contributions are taken out of your paycheck before income taxes are assessed. That's kind of pre-tax. You pay taxes on a lower amount now. What's more, earnings on your traditional 401k or 403b, they can potentially grow and compound without losing some of that growth to taxes each year. So they grow tax deferred. Now, Roth plans are a little bit different. Roth plans feature after-tax contributions. So you pay the taxes on it today, but qualified distributions are tax-free. Roth 401ks and 403bs, they're really available based on the discretion of the employer. So you need to ask your benefits administrator if your company offers this type of savings options. In addition, many other employers offer a match portion for these plans, which may potentially be the easiest money you'll ever receive. If your employer matches a portion of your 401k contributions at a rate of 50 cents on the dollar, that's an automatic 50% return on the part of the money that you've been investing. If your employer offers a 401k or similar plan, take advantage of it. Also, try to contribute the maximum to the plan. Remember that early withdrawals before age 59 and a half might be subject to an additional 10% penalty tax as well. Expanding on the IRAs or individual retirement accounts, this is another important way to save for retirement through a traditional or a Roth IRA, and they offer significant tax benefits as well. Again, with a traditional IRA, your investment is potentially tax deductible when you make the contribution, depending on your income level. And like a traditional 401k plan, earnings can grow and compound tax deferred. A Roth IRA doesn't allow for deductible contributions, but however, earnings grow tax deferred, and the big payoff comes in at the end at retirement when you could tap into Roth assets. You could tap into the earnings without paying federal income taxes, provided you're at least 59 and a half or older and held the account for 5 years. And just like the 401k plans, most early withdrawals from IRAs are subject to a tax penalty. So because of the complexities involved with these retirement savings vehicles, you might want to consider using the services of a qualified financial professional to help you make your investment decisions. Just a few final thoughts for you to keep in mind. Today we've covered the state of Social Security and Medicare, possibly the two most important issues facing current and future retirees. We also review the importance of planning for retirement and taking advantage of those investment options available to you. The next step, right? Next step is yours. Perhaps make an appointment with one of us here to sort out the wide range of choices available to you. You may also want to contact the Social Security Administration to obtain your estimate of benefits. Make sure they're tracking your benefits correctly for you as well. Whatever your situation, keep the following in mind. Again, don't expect Social Security and Medicare to cover all of your retirement costs. And you need to stay up with the Social Security and Medicare benefits and plan wisely. One last point to consider, you could spend more than a third of your lifetime in retirement planning for your retirement so you don't have to rely solely on uncertain futures. Social Security and Medicare planning is time well spent. Again, here at Alliant Retirement and Investment Services, we're here to help you. Again, we can help answer some of the questions you might have on today's presentation, Social Security, Medicare planning. We can help you make some of the investment choices in those retirement plans, consider retirement income options for you, review investment accounts, discuss life events with you, and also help you out with your estate planning, beneficiaries, or generational planning as well. I'd like to thank you for joining me today and discussing these important topics. This is my contact information, my phone number, email address, and the QR code will take you right to my calendar link if you'd like to set up a time to talk a little bit more about your specific situation or creating your personal comprehensive financial plan. Thank you for joining me today.